Hey, Lisa.
Hey, Jennifer.
So Ellen Craig is saying I forwarded her my invite so she could get to the meeting, but I guess maybe mine doesn't work for her. Do you have a way to
Okay.
send her?
Yeah. Let me find.
She said she's getting a message that says it's waiting for the meeting to start.
Yeah, I'm pulling it up now.
Okay.
I have to pull up a separate thing and do it. I'm gonna send her the public one. And who is this?
It's Ellen Craig at Region 10.
Okay. Do I have her email? Let's see.
Actually, let me CC you on my response back to her so you'll have it.
Okay. Okay, I've got it. So does she have the meeting docs?
I forwarded her that.
Okay, good. So Ryan Davidson just finishing up another meeting, so maybe a few minutes late, but we'll be there.
Congratulations, Misty.
Thank you. I was looking at all my tabs. I didn't quite track who had already logged on. Thank you. Did anybody hear anything about the schools being here or not, or Martha on court service unit?
Martha's gonna be late. Ryan Davidson's gonna be late. I didn't hear from any school people.
By my count, we have quorum at the city. Is that correct? Isn't it
If-
4 for the
if
city?
4 gets it for you, yes, you do. And we only have 3, so we still need 2 people.
And the CSA coordinators are not voting members?
Correct.
Okay. Come on, county.
Martha's in like a Louisa CPMT, she said, so.
I just emailed Kevin to see if he's going to be able to join for the county schools.
Kevin Kurz, yeah, he didn't come last month.
Maybe this 3:15 timeframe isn't as beneficial as we thought it might be.
Well, they're not getting it, and most of the people aren't coming anyway, but.
Anybody's summer plans shaping up? I don't know. We can do small talk, can't we? I think we would if we were in person.
Yes, but we are being recorded, so be careful what you say small.
Here's something. I just looked at weather a few minutes ago and it says over the weekend it could hit, I'm not kidding us, 99. I know, such Virginia weather, 99. Yeah.
Okay, Martha said she has Louisa CPMT, but will do her best to be on at 3:15.
She is trying to jump on right now.
Okay. And there's Krista. Ooh, okay, so we got Krista, she's 2.
Sorry, my cat just jumped in the washer.
With
washer?
items in there?
No, it was empty. Just had it open to let it dry out. It's new.
Beth Baptist is coming, but we'll help us.
Anybody opposed to moving this meeting back to 3:30? Is that something we have to vote on?
I don't think so.
That's a good question. I honestly, the other thing to ask is whether this is the right day, like, because I know Ryan probably has Board of Supervisor meetings typically on this day. So really the day and the time is up to you guys for whatever you think is going to work best for all of you.
I thought it was at 3:30 and just looked down and saw that it was at 3:15. So that's why I was 6 minutes late. I'm sorry. I thought I was early and then was late.
Can we add that to the agenda for the retreat?
Great idea.
Could we like go over other stuff in the agenda and get started and then go back to all the action items?
Sounds great.
Who are we waiting for to get a quorum? Both or just
No,
one?
Charlottesville has a quorum. We're waiting for one person for Albemarle.
Yeah, that's a great idea. I'll pull up the agenda and see where we might start, but I do need to read that lovely disclaimer
Hey,
that
Mitch,
you have to read since we're in virtual land still.
do you
so.
see we have someone as an attendee too?
That is one of our IT people. They hang out and make sure that we're not having any Zoom issues.
That's
So
right.
last month I tried to force him to join, and so I won't do that this month.
That's great. Thank you.
So I'll call the meeting to order. And the article here I have to read is this meeting is being held pursuant to and in compliance with ordinance number 20-A16, an ordinance to ensure the continuity of government during the COVID-19 disaster. The opportunities for the public to access and participate in the electronic meeting are posted on the Albemarle County website. If applicable, participation will include the opportunity to comment on those matters for which comments from the public will be received. We all need to include our attendance. So, Misty Graves, Director of the Department of Human Services and the current community attention seat. Sue?
Sue Moffett, the Director of the Department of Social Services for the city.
Let's stick with the Sues.
Sue Houchins, covering for our CSA coordinator, Katie Ralston.
Aaron?
Erin Callis, representative from the Virginia Department of Health, Charlottesville Albemarle Health Department.
Beth?
Beth Baptist, Charlottesville City Schools.
And Krista?
Krista Gallio, probation supervisor for court services, programs rep.
Ellen?
Ellen Craig with Region 10 covering for Nita Davis.
Thanks. Jennifer?
Jennifer Wells, CSA coordinator for Albemarle County.
And Mary?
Mary Stebbins, Deputy Director, Albemarle Social Services.
Lisa, just do it.
Lisa Jordan, Albemarle County, DSS.
Thank you. All right. So I think where we could start on the agenda is to move after the action item section, just go to the review of system functioning and activities, and we'll start with the FAPT update.
All right, so for county, actually this would be for county and city. The private provider rep for FAPT, as you guys know, that term expires June 30th, and we have posted the application process for the city and the county. It's hosted on the city's website. We actually had to extend it out because we had a super small applicant pool. And so we've left it open at this point. We're going to leave it open probably through the end of this month or pretty close to it, just to try to get some more applications. The last time I checked with Katie before she went out on leave is that there had been a few more. So we're feeling better about having one to having several. So that's a good thing. And then the plan will be hopefully to do interviews with the FAP chair or someone on FAP and CSA coordinator, and then have that recommendation back to you guys for the June meeting, so that that person can be in place on July 1st. So that's the goal. We're getting a little bit squished for time, but hopefully we can get those interviews done pretty quickly, so that we can move those forward. And then as far as county FAP goes, I will just say, we're continuing to see rising numbers in foster care and in our CHINS cases. So just continuing to see that growth. I think when Katie did the presentation for program, I think she was saying that the city has sort of continued to not maybe see as many cases as the county is currently seeing. So Sue, I don't know if you, Sue Houchins, I don't know if you have anything else.
You muted yourself.
Mute.
Yes, there you go.
The opposite. Sorry about that. No, I agree, Jennifer. It's just my understanding from Katie is we haven't had the growth or the number of cases that we have had historically. So lucky us for once.
Thanks for sharing that update. Any questions from the rest of us? All right. What about, did anybody have any questions, comments, concerns about the routine foster care expenses and FAPT approved expenses? All righty. And CSA coordinator update.
Okay, so for this, I don't have a whole lot. I just wanted to kind of share with CPMT. I know you guys talk about sort of trying to look ahead and that kind of thing. So some of the things that I wanted to share with the group is just some changes that are coming. And probably Mary and Sue Moffett could speak better to this, but there have been changes to adoption assistance that went into effect, I think, in January of this year. And so I think as we look at CSA and costs and just considering that they're making that process for adoption assistance a lot more sort of difficult. And so it's likely going to lead to increased costs for CSA potentially. I don't know how quickly we're going to start to see some of that. But like, at least on the county side, what I'm seeing some of, and we'll probably see more of, is just they have to have updated psychological evaluations. So information has to be current, I think within a year is what, within 2 years. Okay, so for kids who've maybe been,
Sorry, I might be confused now that I say that. 2 years might have been something else. Sorry.
okay. So again, there's just sort of these increased costs that are probably going to hit CSA for before kids can actually be adopted, because the state is now requiring all of this additional documentation. And then on top of that, the other piece that there's no way for us to really predict how this might affect us is for any kids who may be adopted not out of Albemarle or Charlottesville, but live in our locality. The state has also set some lifetime benefits for adoption cases for like special services, whereas those families previously could go back through subsidy to get services. There's now a 2-year lifetime max on that service. So that's for the life of the adoption. So at any point, if they've exceeded that, then all of those cases are going to be coming to our FAPT to request those services. So again, it's just looking ahead and thinking about the impact that these things are probably going to have on our locality. But the thing we don't know is, like, I don't know how many kids live here that have been adopted from other localities. Like, we don't have any way of tracking any of that kind of stuff. But what we do know is that the state is really putting some pretty stringent requirements on how they're using adoption assistance. And so the impact is likely going to be at CSA. So just making folks aware of that. I'm trying to think of what else. So as far as costs, as you guys know, like, everything is going up. There's a lot less availability. And so we're continuing to see and anticipate that I would say the majority of CSA providers are going to be increasing their rates for this upcoming fiscal year. So again, just preparing for those costs, knowing that they're going to be going up. Everything I've gotten so far, all of them have gone up. So that's all I have for the CSA coordinator update.
I had a question. When you say prepare for additional costs, what would that look like for CPMT?
It's a great question. So, you know, the hardest part about CSA is it's really hard to predict. Like, how do you know how many kids might come into foster care or how many kids might need a parental placement through Region 10? It's really hard to know that kind of stuff. You know, what I can say is on the county side, we've definitely seen a major increase in CHINS cases through Region 10. And the number of those cases that are now moving towards parental placements has been the highest I've seen since I've been here. And again, to say like how many more we anticipate, I have no clue. And that's always the hardest part about CSA is it's sometimes tough to try to get some sort of prediction about where we're headed. I mean, what I see is these increasing number of cases, and then foster care, like, our numbers have been rising in the county. And then the difficulty is if we can't find foster homes, then we're looking at the more expensive placements, which means if they end up in group home or residentials, then we're having to pay the higher local match, which again, it's going to affect the locality. So it's just, that's the kind of stuff that I'm talking about.
Thank you.
And we have a quorum now. Yay.
Welcome, Ryan.
I was also going to let everyone know that Martha has joined me in the office, so she is here. She's just not on camera.
Awesome.
Welcome, Martha.
Thank you.
Sue Houchins, did you have an update to share?
There we go. I don't know what's going on with my internet. I apologize. But no, I don't have anything. Katie didn't give me any information to share. Sorry.
That's okay. All right. We are at the part of OCS communications.
We don't have anything for this month from OCS.
I'll take it. What about program? Krista, do you have a update to share with CPMT?
So I wasn't present for programs this month. I know they completed the gap survey. Jennifer, maybe you're able to bail me out again and talk about that.
Sure. So the biggest part of that meeting was the gap survey, obviously. The only other two things I would mention is we're still trying to set up that CHINS work group. It's just been a scheduling nightmare when you're talking about that number of people, and trying to get everybody at the same time has been really difficult. So I think Katie's plan is to try to just invite folks to program and start at that meeting, since it's already a standing meeting. But I know there are other people outside of program that we want included on that CHINS work group. So we're attempting to do that. Obviously, we want the schools involved, but it's going to be really tough to try to set that meeting up in the summer when the school folks may not be as available. So we're not quite sure when that meeting is going to happen, but we're still working on it. And then the only other update I had was just that we've had some delays with the whole UR for mentoring. And that's pretty much just related to Region 10 having some staffing shortages. And so I don't really have an update about where we stand with that. I don't know if you have anything, Ellen, but I just know that there's been some delay with getting that started.
Yes, I had lost 2 of the staff that were going to be participating in providing that, slowly hiring. So 1 new staff just started this week, and hopefully offering the position to another staff by the end of this week or next week. So it's coming.
That sounds hopeful.
It does, finally. It's nice to have that sort of thing to report.
Absolutely.
So thank you, Jennifer and Ellen, for that programs update. I appreciate it.
Do we need to talk more specifically about the gap survey? Do we need to have CPMT?
So that's under action item.
Well, then let's just start tackling some actions, huh? So we'll start with going back up to the top, the review of the agenda, review and approval of the agenda and the consent items. So we have a motion from the county to approve the minutes and financial reports from March's meeting.
So moved.
Second, this is Erin.
Thank you. I don't know what the order is. All in favor? Any opposed?
Yes.
I don't know where you're supposed to offer additional discussion, right? Where does that go? Doesn't matter. I just trust that you guys will chime in if you have any discussion. All right, let's do city, a motion from the city to approve the April minutes and financial reports, please.
The April minutes, it's different from the county's motion, but so moved.
Second.
All right, all in favor?
Aye.
Any opposed? All right, let's have the same motion from the county as in a motion to approve the minutes and financial reports for April from the county.
So moved.
Second, Erin.
All in favor?
Aye.
Any opposed? All right, nicely done. All right, so we are in the place where we wanted to discuss the Dcsc policy regarding current parental placements. So this came up, I think, last month, and we need to take some action on it. So Jennifer, would you like to sort of frame the context again?
All right. So as you guys might know, our local policy says that we pursue child support for parental placements. And then I think in March is when we suspended the policy through June. And part of what was going on at that point is that Dcsc's whole process has shifted. And so all of the things that we had set up with them on these parental placements has now, it doesn't exist anymore. So it was a good time to bring to CPMT where you all stand on whether you want to continue to pursue those cases. And if you do, we're going to have to come up with some other process with Dcsc because the current one or the one that we had in place, it doesn't work anymore, just because there's no local office here anymore. And so we had like a primary contact that we worked with. We don't have that anymore. So just a lot of things had changed on the Dcsc side. And then there was sort of that whole question around whether you guys want to continue to pursue that or not. That is set by CPMT as far as it goes, as it pertains to parental placements. But we need to decide something because if there's a policy change that has to be made, that'll need to come to the June meeting for your approval or change. So I'm not sure if folks have questions about that. Katie had sent, and again, I think this is sort of a difference between the city and the county, and this is where it can at times be difficult to have the same policy for both localities. Katie had sent what they had received in parental support, and then I asked our business services to pull that for us. And it's pretty sizable, the difference that that we receive between the city and the county. And so I know Katie had mentioned that for the city, she wasn't sure if it was worth the kind of administrative burden that they go through to recoup. I'm just looking at the amount. So the maximum that the city got over from FY18 to FY22, the maximum over one of those fiscal years was $65. And then for the county, the maximum for us was over $20,000. So, so there is a pretty significant difference. So I don't know if you guys need any other information or what your thoughts are, but I open it up to you all to discuss.
Halchins, I'm not sure if Katie gave you talking points, but I would just say from the city's perspective, we're not interested in pursuing support. There's some new, unless we absolutely, in circumstances where we absolutely have to. Some of the evidence I sent on to Misty and Katie that was presented at the most recent CWAC meeting was that, if you increase the financial burden on the family by asking them to pay child support, the length of time to achieve permanency is extended. And as Katie already said, that just really isn't worth the squeeze, since most circumstances in our assessment, most of the households aren't able to pay support anyway, and we really aren't interested in making any changes in that.
In the extension, the data that you showed was 6 months. It increases the time before they can reach permanency by 6 months on average.
So those are foster kids, right? Which is up to each locality on what they do.
Right. So this right. I just
placements
exactly
that we're talking about, which is different because in terms of who we're talking about potentially. And they're not kids in foster care.
No, I understand. And we are not interested in changing things, in making any changes to our current approach to that, where we do pursue support in rare circumstances, but not as usual business.
Mary, did you have any additional thoughts about any extensions or to the current sort of until June 30th when that expires or otherwise?
Well, I'm just curious about what other county reps think. I mean, we have kids, I don't know. I just think it's a bigger financial burden for the county than it potentially is for the city. And I'm not, I think it's sort of a philosophical decision as much as it is a financial decision. So.
And I think if, again, this is a little bit anecdotal, I mean, I can't really back this by like hardcore numbers, but I do feel like some of the differences between the city and county are the folks that get served through parental placements. My guess is that the city probably doesn't, they don't have the volume that we have of them. But the other thing, and Ellen, I don't know if you can speak more to this, but I feel like in the county, we're typically serving folks who have private insurance. They're likely not on some sort of assistance. And those are the folks that really are going to get pursued for support. But the other thing I'll say is, we're only, by our local policy, we only pursue if it's longer than a 90-day assessment program. So this is something where we're looking to fund it sort of more long-term than just like an assessment program would be. So there's sort of that piece of it as well.
So I can speak a little bit again to that. The majority of those families that we're serving through Albemarle, Jennifer, you're correct, often have private insurance, have a little bit more means, but we do have a mixture, certainly, that come through of parents that have Medicaid but are not involved with social services as well. And I think there's just a volume, just a number of, it's a larger area, more families that we serve. I will also add that I think, for families, even of families of means that are going through this, going through the DCSE process has been a challenge for every family that I've seen go through. And, can be painful. Frequently, we try to send the case manager with them to help explain and navigate. And when they're a parent who's going through already dealing with a child who's in a mental health crisis and they're seeking such a high level of care, it really does add an emotional burden, I think, to that process. That said, the difference in costs to the county versus the city is significant.
A couple other points that I just thought of. If CPMT has a policy, is there a way that we might hear, like CPMT might hear things on a case-by-case basis for those extenuating circumstances in which pursuing support would not be necessary? There's a specific case that comes to mind that involves an adoption and the circumstances in which, in order to support that child's parental placement, can't happen if they're also, because of the financial burden, they can't also it's just they're not able to their ability to pay would be impacted. So I don't know the assessment, who does the assessment of the ability to pay and what sort of factors they take into consideration outside of income level. Maybe there's some other exceptions that can be made, I'm not sure.
So a long time ago, back before CSA was moved under the 2 DSSs, CCF managed their own parental copays. And so I think what was discovered back then, and again, this goes back before my time, but my understanding of what happened back then was that it really wasn't equitable and it really wasn't followed the greatest. And so there was a lot of kind of discrepancies about who paid and who didn't, and what the consequences of that were. And so this whole process, I believe, came about because it was a way that everybody got referred to DCSC. So then it was up to DCSC to make that decision about what the support amount should be. And that's where CPMT landed way back when. Now, again, you all have the option to do this however you want. It's your policy as it pertains to parental placements. So if there's something that you want changed or added, that's something that we could put in here. The bigger issue is that our local policy says that we refer these cases to DCSC. And so if we're going to continue to do that, we're going to have to figure out how to make that work. Because like I said before, part of the problem is all of these cases that go in are all put into the same bucket. So like, it looks like these kids are in foster care and they're not, which is hugely problematic. And again, DCSC, because of their changes, we don't have a person to work with anymore on these particular cases because they're different, but they all get treated the same now, and that's what's changed. So I think part of the question is what we're going to do about that piece of it. And then if you all want to add additional exceptions about who gets pursued, we can obviously put that in local policy. But I will also add, like, the more layers we add to it, the more administrative burden you're going to be putting on CSA, and I'm just not sure what the capacity is to absorb all of that. So it's like, you got to figure out the balance between all of that.
Yeah, and I think that the thing I remember from what the period that Jennifer's talking about was that it depended on the availability of the CSA coordinator to be able, like, is it a time when she had a lot of time to pursue it, or was it a time when it happened where she was overwhelmed? So there was no consistency in which cases were pursued or not pursued. And then there was an administrative burden to even manage, like, who has made payments and who hasn't, And so we had to depend and give that over to our finance folks who luckily took that on. So for us at the city, I just know as an administrative burden, it was like wonderful to have DCS do all that and just send us the reports of what they collected, because collections was a really big issue is what I remember. So, you know, who's going to pursue collections once you put an order in? I mean, DCSE was doing all that. And if you want the CSA coordinators or a CSA coordinator to do it, there's just not enough time.
So, Sue, sounds like you have said that in your perspective, your opinion, you would not like to modify the current way that city folks are pursuing that, correct? So,
Right, I talked to Jenny, but after, I'm wondering if I understood everything Jennifer said, 'cause it sounds like we have to modify something because what's in place doesn't work.
Right.
But do we have to have the same policy? Like, we don't want to have to be pursuing support in most of the circumstances that we see in our locality.
are you able to name what the circumstances are that in which you would pursue it?
No,
I mean, I'm not like putting you on the spot. I don't need you to like name it now, but like in a policy.
I mean, Sue Halton's helped me out here. I think for parental placements, we just don't see the types of situations that you guys do.
I can't even imagine getting a $20,000 check from anyone that we've ever served for the last 20 years that I've been involved with CSA. I mean, even if that's cumulative over a period of time, our folks just don't have the resources that they would ever, I mean, unless they win the lottery, which none of our people have done that I know of. I mean, I'm joking, but honestly, I don't think, I mean, I was part of the decision and the recommendation of, you know, putting this over to DCSE at the beginning, and now, and I was always in agreement with doing something. We couldn't continue the way it was because it really wasn't working. So at the time it was a really good idea, but having looked back at what has actually been accomplished, I feel like the administrative burden, not only on our financial staff, but on DCSE, hasn't been worth it for the city to even have a policy. I mean, and I'm one of those people that I feel like we have to be fiscally sound in our decision making. You know, we represent the city, the people of Charlottesville, and I don't want to just throw money away. I'm really big on that, but I feel like in this situation, it's just not worth the added administrative burden on anyone for the city. But then again, I don't know for the county, because you guys seem like you're more successful or at you know, recouping stuff from people who can afford it. I mean, I don't think that we as localities have to have the same policies. I think it's better that we do, but yeah.
Any other thoughts from other members regarding pursuing, not pursuing, changing policy, what that might sound like?
Maybe I missed this, but what are we talking about in terms of dollar amounts for the county? Because I kind of wonder, you know, that whole cliche is the juice worth the squeeze on this? And if it's, you know, we're talking small amounts versus an exorbitant administrative burden to deal with this now because of these changes, then do we have to look at it a little bit differently? But if we're talking, you know, six figures, then, you know, that's a whole different, that puts it in a different place in my mind.
So here's what I can share of the information that was shared with me. So for the county in FY19, we took in $17,041. In FY20, we took in $20,335. In FY21, we took in $2,666. And then in FY22 through February, we've taken in $561. So that's, again, the numbers are a little bit hard to follow. I mean, my guess is some of this is due to COVID. And the other piece is that there have been some, I feel like some pretty significant delays in the court system as far as Dcsc being able to get those cases in. So you're having a major backlog from that.
Forgive me if I should know this. Is there a certain time frame where that money can be paid, or it can go on? Does it have a hard stop?
So Dcsc, I mean, folks can get arrears so that Dcsc can continue to pursue even after like the parental placement has ended. So like, I mean, there have been times that it's, at least that I've seen, where I wasn't even familiar with who the particular case was, because they continue to pursue support. And again, that's where having Dcsc in that position administratively was much more feasible than what CSA would be able to absorb. The other thing that I'll tell you guys, and again, like Sue Houchins might be able to speak to this more than I can, but I know back when this all started, there was a huge work group. This took a long time to get through what the policy was actually going to end up being. So I would throw out there, I don't know if you all want to consider trying to put a work group together to deal with this issue. But that might be a way to continue to work on it if we can't come to a resolution here. The other thing is, though, if that's something you want to do, then you're going to need to extend the suspension that you currently have in place. And then my other issue is going to be for those folks who were assessed prior to you guys suspending this policy that are continuing to be pursued. What are you going to do with those folks? Because at this point, we would not pursue anybody currently, but we are still pursuing those folks that were already set up previously. So then you have to make a decision about what you want to do with them.
I'm not sure I've heard anyone in support of continuing with the DCSE policy, or am I wrong about that?
I think I've heard folks saying that the DCSC policy that is currently in place is problematic, yes. But I do think that folks are interested in continuing some sort of suspension of referrals until the new policy can be written. So yes to continuing the extension, yes to, needing to change the current policy, potentially. It sounds like for the city, that is of interest. And for the county, it's still not clear given the financial recoup of those funds.
Which still is not a tremendous amount of money, even though it's significantly more than the city. I mean, is it really worth it? I don't know. Like, I don't know how to make that determination.
Do we need more time to like consult with folks that would need to make that determination?
Misty, in the end, what do we have to have? We have to have a uniform policy on pursuit of support, or we can have two policies on pursuit of support.
Sounds like we can have two policies if that's the way we'd like to go. The preference is to have the same shared policy.
So it sounds like
but we could have two policies.
we can get there if we're talking about parental support, and our feeling is we just don't have the same types of cases that you guys have. That Almar sees. I think we could get there with one policy, but honestly, I need to understand the data that you all have looked at a little bit more to have a strong opinion on that. So is it possible to continue this suspension for now? And maybe Mary and I can get together and take a look at the numbers with Katie and Jennifer and come up with something that works for everybody?
Works for me.
I'd like to just suggest, and to address what Jennifer brought up, that the extension that we offer, is it possible to offer that a suspension to the ones that were previously being pursued? That are currently being pursued? Can we stop? Can we make a action item that the extension will include the ones that are currently being pursued? Is there opposition to that?
That would take a motion and an action from CPMT.
Great. I can make motions, right? Even though I'm sharing? Okay. You're on your own, guys. We can do this. I believe in you.
Happy to make the motion, just need a little help crafting it.
I feel like these people in these little boxes are going to do just fine in supporting you and crafting that.
So, yeah, I don't even know where. So, is it that we're making a motion to extend the suspensions and to add on to that, or does it need to be two separate motions? I guess that's part of my question. Takes about with the extension and to include the previously pursued.
I would say one motion because there hasn't been a lot of dissension between the two. They could go in one.
And do you have to put an end date on it, or is it just indefinitely until we recreate the policy?
I'll take back what I said about being able to craft a motion.
Who's up? Who's up next? No, just kidding. I think you got it, Ryan. I need to know from Jennifer or Sue Halchins if we need to add a specific time in which something expires, or can it be, and this will be in place until a new policy is created.
Yeah, I think it's much cleaner to do it that way. That way you're not under the gun each time you set a deadline if you don't get to it.
We got it.
All right.
From the top, Ryan Davidson, from the top.
All right, I'll try. So I move that for the county, this is county only, correct? Okay, I move that for the county, we extend the suspension of pursuit of collections until such time as CPMT makes a motion to end that extension.
And to include.
Oh, and to include suspension of previously pursued collections.
I second.
I third.
Okay, let's do this. All in favor?
Aye.
Any opposed? We've already covered a robust discussion. Good
Can
job,
somebody
everyone.
quickly tell me who seconded?
Mary.
Thank you.
Administratively, once this extension that includes the previously pursued, who takes care of letting the folks know that are previously or currently being pursued?
So I'll notify Dcsc and then they'll notify the parents.
Okay. Someone from the city want to take a go at this?
Okay, I move that the city continue the suspension of pursuit of child support and also cease pursuit of support for or support orders that have already been submitted or entered.
Second by Aaron.
All in favor? Aye. Any opposed? Okay. That's wonderful. And then we'll circle back around to Katie, Sue, Jennifer, and Mary for a suggested permanent policy, but we know we have time. And if you need to bring back questions to CPMT to chew on again, we can do that ongoing until we get it.
I'll talk to Katie when she gets back from vacation and we'll send out something to you guys, okay?
Great.
Thank you. Appreciate that. Thanks, everybody. All right, so does that take care of A and B? Right? So now we're just looking at provider agreements. We need to approve the provider agreements.
Yes, much easier. So I will say, I only sent out the ones for the county, but they are the same for the city. You just have to replace where it says Albemarle County with Charlottesville. So that's the only difference between the two. But we have to have separate motions for them.
Does anybody need time to review those before we vote on them? Okay. Were there any major changes from the last
So-
version?
So the county attorney added some language that she said was actually required to already be in there legally, which, so that kind of stuff got put in. And I think it had to do with like non-discrimination and some other, other pieces of information that were supposed to be in there. So that's the biggest parts that got put in. As far as updating anything that we currently had in place, there really wasn't any major changes. We left in the language about the private day placement because the General Assembly still hasn't finalized their budget. So we don't know how that's going to affect what the rates that can be set by the private day providers. So we'll fall in line with whatever the General Assembly says.
Okay. So may I have a motion from the county to approve the FY23 provider agreement?
This
I move. Oh,
Oh.
go ahead, Erin.
This is a motion to approve the FY23 provider agreement.
A second. Mary seconds.
Okay, all in favor? Any opposed? All right, thank you. City's turn to approve the FY23 provider agreement.
I move we approve the FY23 provider agreements for Charlottesville.
Thank you. Second?
Sue Moffett seconds.
All right. All in favor? Yay. Any opposed? All right. Thank you all for getting those to us. I know last month when we met, we weren't sure if we would be able to approve them both together. So I appreciate you making sure that that got through on time so we can do it together. Thank you. And the service gap survey. So we need to discuss those separately. Is that right?
So program actually did all of the legwork on this. It's just being brought to you for your approval. If you all have any changes or additions or anything that you don't agree with, that we can certainly add that to what's being submitted to you from program.
Anybody have any discussion about what program put forth?
I think we talked about it earlier on, right?
Does anybody have any adjustments to what program is putting forth for the city folks and for the county folks? So it looks like the I'm switching back and forth here. Anything for the county needing to look at? And let me know if you need me to pause so that we have a chance to look through it. All right, then. We don't need to pause. I'll go ahead and ask for a motion to approve the service gap survey. I need one from the city and one for the county. Who's going first?
So move for the city.
Second.
All in favor? Any opposed? Okay, so let's do that again for the county.
This is Aaron, move for approval for the county for the service agreement, service gap survey, sorry. Legal right.
Second, it's Ryan.
Okay, all in favor for the county? Any opposed? Okay, we have concluded the action item portion of our agenda today. All right, so now we are into other business, I believe. So we're going to talk about the work plan equity statement. I need to pull that up. Does anybody need me to like share the screen here? Or do we feel like, you want me to go ahead and share a screen? Yeah, okay. So just to open up the conversation, what sort of resonated with you all most? What parts of this did you feel like really were important to include in our statement, or what sort of, like I said, resonated with you most?
So full disclosure, I just copy pasted from each of the existing organizations, the partner organization statements, and compiled it together. So I'm hoping something resonates with people.
Well, that's a really interesting way to approach it, though. So is that you took the time to sort of see what others folks' beliefs and values and commitments are, and pull it all together. I think that's really neat how to tie things together.
This is Aaron. I think one of the most remarkable statements is the one that says, without intentional commitment to addressing personal, institutional, and structural racism by the CPMT, inequities in our organization and services will persist, which is absolutely true. That's the last piece. Under challenges we will overcome or are overcoming.
Mhm. Who else has something to share as far as what resonates or what they feel like is really important to highlight?
I did like the statement on the provision of the anti-racist competency-based training. I think that's important to, that we're going to advocate for that training and continue to push for that.
Where is that?
It's the
Oh, got it right here.
first one under we will advocate.
Mm-hmm.
Once you think you know it all, you're in trouble. There's always learning. There's always learning that can be done to better yourself and the group.
Absolutely. Thanks for sharing, Ryan. What are some ideas that you all have? So we commit to assuring the provision of racially and culturally sensitive services for the community we serve. How might we at CPMT level assure that?
I'm not sure if this is going to answer that question, Missy, but one way would be to look at our outcomes by race and be transparent about that, report it back to our communities.
Mhm.
I think our use of the provider satisfaction survey is a way to try to get feedback from families. And that's some of the questions that are included in that.
That's absolutely right. Good point, Jennifer. Those are two concrete things that can be done and we can see it. Yeah. Are there things that folks feel are missing? Things that they appreciate about their own anti-racist statement or their diversity, equity, inclusion statement that they'd like to see added?
I think it's very comprehensive.
Great. I think it's excellent, and I appreciate Sue, you doing the legwork and being intentional about including other folks' perspective.
And Nita gets credit too.
Mhm. So I think the discussion here is, this is something that when it came up, we talked about places and spaces in which we might use this statement. So it just doesn't become a performative statement that we have to check a box that we have one. How might we use that? I think two of the things that we talked about is one, it being included in our provider agreements, but because of the timing, we weren't able to get that. So I think the intention is for the FY24 provider agreements, that to be included. And then we talked about sort of embedding this into our agenda and continuing to review this at some intervals to continue to make sure that this still resonates. Any other suggestions on how this statement might be used or implemented? How do you all currently use yours?
Well, I can tell you ours has been sitting in a computer file for a couple of years, but at our June staff meeting, we're pulling it out again and we are switching it up and ask everyone to sign that commitment at their annual performance evaluation.
Nice.
What group, who was that? Who said that?
Sue Moffett from
Yeah.
City.
Sue, okay. I can't see y'all. I can only see my paper I'm typing on.
Sorry, Lisa.
It's okay.
Is there a way that I know we're virtual, but is there a way that we can at least electronically sign it as CPMT members and have it sort of live with our policy manual?
Yeah, I mean, I can send this out probably through Adobe Sign if folks want to, once we get it in final version, I can send it out that way.
This is Erin.
Anybody opposed to doing, signing that as a collective and then embedding it with our policy manual?
Mm-mm. This is Erin. I was just going to say, do we need to say like the part that says assessing our own performance and disaggregating the data we collect by race? Do we need to say continually assessing or ongoing assessment? So it says something like that's something we're continually doing, not just this statement is here and here it is. Does that make sense? Or ongoing education? I don't know, ongoing. I know it says it all there, but just something that says this is an evolving process.
I would agree with that. I wondered if we want to just take that a little bit further and be more specific and say, we'll do this at our quarterly, what is that document called? I'm having a moment. Our action plan, our work plan. That's it. Can we just say that we will consistently review those outcomes at our quarterly review of work plan. Alrighty. One of the ways that we started to use this, our statement at DHS, is that we put it on our website, which we don't have one, but we also put it on all of our job postings. So it says like, here's the general roles and responsibilities, or like an little introductory paragraph, and it starts with what our department is about. And I wonder if there's a place for the parent and provider rep applications that are going out there, that they would be made aware of that this is part of our commitment and our intention, and that could go with somehow be embedded in the application. I know it's a little late now because the application's already up, but future applications, when those expire, future applications will include our statement.
Yeah, we can do that.
And can we also, as part of the interview process, you said you do interview the candidates, right? And make some recommendations. So can we include an interview question that references the statement and how they may feel like they could contribute to that statement?
So yes, we can do that for the FAT, but CPMT is actually appointed by the Board of Supervisors. So that would be handled differently than FAT.
Gotcha.
I apologize, but I have another 4:30 Zoom meeting, so I need to Zoom from you to the next Zoom.
Thank you, Beth, for coming and participating. I appreciate it.
Sure. Take care, everybody.
Yeah. So where there are interviews, we would incorporate a question regarding or referencing that statement and how they may contribute. Any other suggestions for now on where we might apply and use this statement? Alrighty. Any other discussion about that? So what I have is the next steps is that Sue, can you add that language to the just being more specific about how we're going to disaggregate by race? And I think that was the only addition that was suggested.
I think Aaron said continually assess.
Oh, yeah, that's right.
A little bit, sure.
And then you'll send it to Jennifer, right, to put it into a PDF signable
Okay.
thing, and then circulate that around. And our deadline to sign that will be by the next CPMT/retreat next month.
All righty.
Thank you both for doing that final step. And thanks again, Sue and Nita, for putting it all together. I appreciate it. Going back to the agenda, any agency updates from you all CPMT members? What's new and exciting? Celebrate what's going on in our neck of the world.
This is Erin. I will say it's a celebration for her, and we're excited about it for her, but it's also a big transition. So Dr. Bonds is leaving as the health director, That's a big old fat deal. So we're dealing with transition and managing with several different people who are going to oversee larger operations. And I think today posts her position so that we can fill that position. They are not easy to fill. So it's just a big hit, you know, and delightful for her, you know, and here, like she is, I'm pointing over here because I'm in my office, right? So she's my next door neighbor here, and you know, there's a lot, and we've been through a lot together. So anyway, that's my big news to pass along. Shoo.
Well, sending good juju and vibes over your way so that you get someone excellent to support your all operations. Any other news, accomplishments, announcements? Hopefully everybody was able to sign up for the groundwater training if they were available. Looking forward to having a follow-up discussion about that during our retreat as part of our agenda. All right. Speaking of, that's the last thing on our agenda, I believe. Retreat planning discussion, which, to just recap, the idea was to have a sort of a joint experience on the anti-racist work. And so we are going to be doing the day before the training. Obviously it's virtual, but still doing that together. And then we will debrief that the next day at our CPMT retreat. So we will start at 2 o'clock. Someone correct me if I'm getting that wrong. So we'll start at 2 o'clock that day and start from 2 to 3:15. We'll have our debrief. I believe that's what it is. 2 to 3:15 would be the debrief. And then after that, we will start to fill in our work plan and make any adjustments to our work plan goals during that time. So those are the two major highlights and to-dos next month.
What date is the retreat? Is it the normal date for the normal meeting?
If that is, I think it's June 15th.
So I was just going to add, we also need to go over the Cqi tool, which is something we're supposed to do annually. And that is, if you guys remember, Caqi usually took the lead on it. So we'll just try to get through that part of it quickly. If you guys remember it or not, it's where we document your observations about the data points that we provide. So Katie and I will hopefully have all that ready for you guys to look through. Yeah.
I like that part. I believe in the two of you. You can do that. Absolutely. Okay. Any questions about the retreats? It's been a while since we've finished up early. Well, look at that. That's refreshing.
Sorry, Misty, what's the time for the retreat again?
The retreat, it will begin at 2.
At 2. And
Will it run till 5?
We will hold that time.
But hopefully you'll be done sooner, but it could be till 5.
That's correct.
Okay.
We don't have our normal business agenda votey rigmarole thing that we have to do. So it's more relaxed, conversational, not as like rigid to like what the things that we have to do. There will be 3 general things that we will get to and hopefully have more conversations than ayes and nays. All right. Have an awesome afternoon and great rest of the week. I appreciate you